Welcome everyone to Easy Farm, where we quickly cover high-yield topics to prepare you to succeed on your board exams, clinical rotations, and your practice. This video will cover the top 10 highest yield board exam concepts to know for Class 1 antiarrhythmic drugs. Number 1. What drugs are considered Class 1 antiarrhythmics? There are three subclasses of Class 1 antiarrhythmics. Class 1A, which is quinidine, procainamide, and disopyramide. Class 1B, lidocaine and mexelotine. Class 1C, flecainide and propafenone. Number 2. Mechanism of action. Class 1 antiarrhythmics work on atrial and ventricular myocytes and Purkinje cells. They block sodium channels, decreasing the rapid depolarization phase 0 of the action potential, slowing conduction, and subclass 1A also has ITO channel activity. Number 3. Channel activity. The 1A subclass block K channels or ITO activity. Class 1B block sodium channels. Class 1C also block sodium channels. Number 4. Class effects on ECG. The 1A class ECG effects are prolonging of the QT interval or widening of the QRS complex and are thus associated with risk for torsades. Class 1B actually decreases the QT interval. Class 1C has minimal effects on the QT interval but the greatest widening effect on the QRS complex. Number 5. When to use or not use. Class 1B is useful for ventricular arrhythmia. Do not use 1C in cases of structural heart disease like CHF or MIs. 1C, flecainide, is used with atrial flutter. Number 6. Class 1A buzzwords and clinical pearls. Quinidine is associated with Brugada syndrome, has ITO activity, positive combs, G6PD deficiency, synchronism, and drug-induced lupus. Disopyramide, negative inotrope, that's anticholinergic, beneficial in HCM patients, but watch for anticholinergic side effects. Procainamide, the active metabolite is renally cleared, so caution in patients with renal insufficiency. Associated with blood dyscrasias, drug-induced lupus, and it's for injection only. Number 7. Class 1B buzzwords and clinical pearls. This class as a whole is useful for ventricular arrhythmia. Lidocaine is IV or injection only, shortens the QT, and is not for WPW or Adams-Stokes. Mexelotine has a risk for DRESS, cardiogenic shock, and blood dyscrasias. Number 8. Class 1C clinical pearls and effects. Do not use in any cases of structural heart disease, associated with CNS effects and visual disturbances. Flecainide is used mainly for atrial flutter and may be pro-arrhythmic in cases of long-standing AFib. It also must be stored in a light-proof container. Propafenone has beta-blocking effects and a metallic taste. Number 9. Here's a quick mnemonic to learn the drugs in each class. Number 10. All antiarrhythmics may be pro-arrhythmic as well. Thanks for watching. Be sure to like and subscribe for more of our highest yield board exam buzzwords and concepts.